Hello everyone, what's up? In this video we are going to discuss about the antiviral drugs, and in this video we will discuss about specifically the anti-influenza drugs. Now as you know that we have different types of the viral infections. We have the HSV, VZV, CMV, HIV, hepatitis B, C, influenza, coronavirus. So all of the drugs that are used to treat these infections that are caused by these viruses. So basically we will study them in the different videos, but in this video we are going to discuss about the anti-influenza drugs. And as you know, all my pharmacology lectures are from the katzung book, and this topic as well is taken from the katzung. Now, without any further delay, let's get into it. So first of all, we have the anti-influenza drugs. So here, the influenza virus is basically enveloped virus. It means that it would have the envelope around it, and then it has a single-stranded RNA into it. Now, this influenza virus has basically the three types of proteins. These are very important for you to remember. First, it has the M2 ion channel. Then it also has the two transmembrane proteins. The one is the neuraminidase and the other one is the hemagglutinin. Now, the virus, when it has to interact with a cell, it basically uses these transmembrane proteins in order to bind to the sialic acid. And then it gets entered into the cell. And now you can see that it also takes the membrane of the cell with it. Now here you can see the role of the M2 proteins here. So M2 ion channel basically allows the positive ions to enter into the virus, and thereby it causes the RNA to be released from this virus, and then it gets entered into the nucleus of the cell. Now this RNA would undergo the transcription in order to form the messenger RNA, and this messenger RNA would get out of the nucleus into the cytoplasm, and then it is translated by the ribosomes, and these translated proteins are then modified by the Golgi apparatus in order to form the transmembrane proteins as well as the M2. Now some of the proteins that are translated by the ribosomes, they get entered into the nucleus, and when they get entered in the nucleus, they form the RNA. So here we have the RNA, and here we have the transmembrane proteins. So now we have all of the structural proteins that are completed, and this would form the virus. It cannot spread unless the neuraminidase would remove the sialic acid. So after the sialic acid is removed by the neuraminidase, so the virus is ready to spread. Now we have the three different classes of the drugs that are used to stop the vital processes that are undergone by this influenza virus. So here you can see on the first step, we have the M2 ion channel inhibitors that are basically inhibiting the M2 ion channels. Then we have the endonuclease inhibitors that can basically inhibit this transcription process. So in both these categories, what we have in the endonuclease inhibitors, we have the baloxavir, and in this M2 ion channel inhibitors, we have the amantadine, rimantadine. And now here you can see that in the last step, in which the neuraminidase was very important to remove this sialic acid so that the virus can spread. But here we have the neuraminidase inhibitors that can act at this process in order to stop the spread. So in this category, we have the oseltamivir, peramivir, and the zanamivir. Now let's discuss about each drug in detail. Now let's discuss about the first category, that is the neuraminidase inhibitors. So basically, these inhibitors can block the influenza A and B viral infections. Alright. So this is very important that neuraminidase inhibitors are against the influenza A and B both types. Now what is the mechanism of action of these drugs? So they can inhibit the neuraminidase. Why? Because they can act as an analog of the sialic acid. That is why they would inhibit the removal of the sialic acid by the neuraminidase enzyme. Then we have the drugs. So oseltamivir, zanamivir, and the peramivir. So in the oseltamivir, these are against the viruses that are baloxavir resistant. And then they are taken through the oral route and they undergo the liver hydrolysis. They are excreted in the urine via the kidneys. Now what is the adverse effect? So the adverse effects are the GIT discomfort, self-injury, and delirium. Then we have the zanamivir. So in this case, it is taken through the inhalational route and then it is excreted in the urine via the kidney. Also, now the adverse effect of it is very important. It causes the bronchospasm. That is why it is never used in the patients with the airway disease. Then we have the peramivir. So this is excreted in the urine via the kidneys as well. And now the adverse effect of it are the hypersensitivity reactions and the neuropsychiatric events. Now what is the mechanism of resistance that can occur in this case? So when there is mutation of the neuraminidase enzymes, these drugs cannot act. Now our next class of drug is the endonuclease inhibitors. They basically block the transcription and they are against the influenza A and B. They can inhibit the oseltamivir resistant viruses. Then the drugs in this category is only one. So here we have the baloxavir. So this is the only drug. Now the contraindication is that it shouldn't be co-administered with the polyvalent cation containing products and the milk product. Now let's discuss about the last category, and that is adamantines, or we can also call them the M2 ion channel blockers. Now the mechanism of action of these drugs is that they block the M2 proton ion channels. In this way, they would inhibit the uncoating of the virus. Remember that? Now here we have these drugs, they are against the influenza A type only, and this is very important that they are only against the A type. So you can remember that this A and the A for the adamantines. Alright, then these are excreted in the urine, and the adverse effects of these drugs are the GIT adverse effects and the CNS adverse effects. Now this category of the drug is contraindicated in the pregnancy. Why? Because it has the teratogenic effect. Now the drugs which are present in this category, so we have the amantadine and rimantadine. And rimantadine is 4 to 10 times active than the amantadine. And this can be concentrated in the nasal mucus and in the CSF. Alright guys, I hope that you understood it very well. And if you have any questions, let me know in the comment box. And yes, if you haven't subscribed my channel yet, so please do subscribe, and until next time.